The week-long celebrations marked around the world is mainly to acknowledge the compassion, professionalism and round-the-clock commitment of nurses and midwives caring for patients in the public health system. Chief Nursing and Midwifery Officer for Bono East Region, Ms. Joyce Ishen, who was speaking on the sidelines of a brief program held in Kintampo, underscored the significance of the work nurses and midwives do across the Bono East enclave.
It's very important. Looking at the theme for this year, our nurses and midwives are future, the economic power of care. This theme throws more life. It focuses on the in-depth analysis of what nurses and midwives are doing in the region. And also, when you look at it, it also gives us the investment that nurses and midwives deserve. We have to invest in them. We have to see them as an investment, not a cost. So we plan that we have to celebrate our nurses and midwives so that they can do more.
Ms. Joyce Ishen, however, bemoaned the equity index of nurses in the area and was quick to add that the high number of females in the nursing profession goes a long way to affect the efficiency of nurses across the area.
The equity, when you talk of equity, in some areas we have more, in some areas they are not willing to go because of one or two reasons. So it's not encouraging at all. And as I said earlier on, looking at the nursing population, you realize that about 76% of us are females and the rest are males. And they are also in their reproductive stage, average age of 35 years. So they are reproducing, they are giving birth. And when a nurse is pregnant, it means that nurse cannot run the normal shift for 1 year, 9 months. Why am I saying this? Because the person is pregnant, the person is not going on night duties. So if you don't have enough nurses to run the night for you, those who are not pregnant, who haven't delivered, to run the night program for you, it becomes a challenge.
Deputy Regional Director in charge of clinical care, Ms. Helen Agbojo, was thankful to the nurses for their sacrifices over the years, but was quick to appeal to them to improve their customer care. A move, she said, would help enhance the health of the patients they attend to.
The week as a whole means a lot for us. We want to use it as an opportunity to celebrate our very hard-working nurses. Aside appreciating them and congratulating them, we also need to, express some of the areas or the desires that we think they need to improve upon in the healthcare system. One, for me, is the customer care, which I will always speak about, the need for us to accept people, to treat people with a lot of respect and dignity. A little smile for a patient, it goes a long way to help them. And so much as they are doing well, we want them to open their teeth and be nicer to the people who come to them on a daily basis. A little help here and there, more than they are doing. We are not saying they are not, they are actually doing very, very well, but we just want to encourage them to do better for humanity.
The 2024 Nurses and Midwives Week was observed under the theme, Our Nurses and Midwives, the Economic Power of Care. Anna Sabit, Joy News, Kintampo.